Hey, it's Dr. Balt here at Long Neck Chiropractic. Thanks so much for, again, checking out our website, drbalt.com. As you know, every week we are putting up a video so that we can give you more information about your health and so we can optimize your health care in the future. Today we're going to continue on with our discussion of back care versus health care. And you know, folks, many people come into my office with a back or spinal related complaint. Neck pain, back pain, headaches, sciatica. We would call these musculoskeletal complaints. Sometimes we get some complaints that are neurological in orientation. Sciatic pain, tingling, numbness in a leg, tingling, numbness in an arm, certain types of headaches and things like that. And of course, you know, chiropractic is an excellent way of helping that or improving that condition. You know, chiropractic has been somewhat pigeonholed into the treatment of the neuromusculoskeletal condition, but I want to give you a little history lesson today. Chiropractic was kind of rediscovered in 1895 by Dr. David Daniel Palmer. And Dr. Palmer found that the nerves that exit between adjacent vertebrae supply the various organs of our body. And misalignments in the vertebra can actually disrupt the communication pathways between the brain and the body, causing disease, dis-ease, or dysfunction in the organic system. We would call that viscerosomatic dysfunction. What that means is that the brain is no longer has the ability to communicate with the body, and the body is having difficulty communicating with the brain. And as such, when you disconnect those two, the body begins to act in an abnormal state. Given time, oftentimes something called symptoms start to develop. And given time, then you start to develop something called dis-ease. So we have folks coming into our office, obviously for neck pain, back pain, headaches, and things like that. But a lot of the folks start reporting that after those problems begin to clear up, that something else starts to happen. You'll find a person who's had digestive problems, maybe not have the same type of indigestion that they used to have. Or somebody who might have had irregularities with their bowel. That seems to function better. Or someone who's had chronic sinus trouble, chronic throat problem, ear infections, all that stuff starts to feel better, and then they begin to step forward and ask me, what's going on? And so I show this little chart, and this chart actually outlines the different vertebrae that comprise your spine, the different nerves that exit from that spine, and the different organs and areas of the body that those nerves control. And the last part of this chart is going to be possible conditions that happen when there's a problem with the spine. And many people begin to relate. I do have lower back problem, and I do have problems with my bowel function. Or, I do have lower neck trouble, and I do have headaches, a sore throat. And they begin to connect not only back care, but really health care. Because chiropractors have been the leader in the health care movement since the early 1800s. You know, we're now serve on the staff of medical centers, some of the top researchers in the world of chiropractic. And some of the greatest research coming out right now is not how to manipulate a person's symptoms. That's called the practice of medicine. You could take an Advil, a Motrin, and things like that, and obviously feel better for a short period of time. What we're trying to offer is something called health care. True health care. Medical care is for acute injuries. It's for major disease processes. And then we're not talking about those type of patients. What we're talking about is the people who are slightly out of their normal health. And by giving them corrections in the spine, we can help them feel better and allow the body to heal better. And most of my patients say that they feel better physically, a lot of their conditions begin to clear up, and the majority of our practice becomes what we call a maintenance type practice. And those are patients who might have some aches or pains, but their major concern is staying well. And that's my concern. And oftentimes what we'll end up doing is we'll make some suggestions. Maybe a suggestion for a specific exercise. Maybe a suggestion for a slight change in nutrition. Maybe a suggestion for other things that are related to more natural wellness. And the ultimate goal of a physician is not to try to only get people well, is to keep them well. Benjamin Franklin once said, the doctor of the future will prescribe no pills, but will interest his patient in care of the human frame. That's my goal in this office. And if we work together, that's what we can accomplish together. We look forward to hearing from you next week. Feel free to keep checking our website, drbalt.com.